About 1 in 5 women will develop a pelvic floor disorder of some kind. So it's very common. In many instances, women have more than one. This is a model showing the inside of the pelvic floor, and this is where the uterus is, the bladder, and the rectum. And this is all these muscles here on the outside are what create the pelvic floor. So pelvic floor disorder is really any disorder that occurs in this part of the body that's inside of the pelvic bone. Pelvic floor disorders include many different conditions, the most common of which is urinary incontinence or involuntary leakage of urine. We see in women who have babies that down the road afterwards, they have trouble jumping on a trampoline. They tend to leak urine with cough, laugh, or sneeze, exercise, and that's called stress urinary incontinence. The stress not being that they're stressed out, but actually the stress on the body with certain movements or exertion can cause leakage. Women who have babies are also predisposed to have what we call pelvic organ prolapse, and that is from weakening of the vaginal walls. So what happens is a woman will, be going about her day, and often after a long day of walking, she'll feel some pressure or even what we call a vaginal bulge. They'll feel like a little golf ball that comes out of the vagina. So after menopause, we do see a higher proportion of pelvic floor disorders, stress incontinence, urge incontinence as part of overactive bladder syndrome, as well as pelvic floor prolapse. And then women also have what we call genitourinary syndrome of menopause, or what we've historically called it is vaginal atrophy. What we often see is women don't discuss these conditions with their provider. And that's important because a provider can't help a woman if she doesn't tell them what the problem is. And so, and not all doctors will screen and say, do you have leakage of urine? If you're screening for diabetes signs and symptoms, for many other medical problems, chest pain, often need the woman to say, hey, I'm leaking on myself with cough, can you help me? It's embarrassing to talk about problems with the vagina, no matter what those problems are. And feeling of a vaginal bulge is often associated with shame for women. They feel there's a problem in their vagina. Women are worried about their vagina being too big, not the right size, there's something falling, this is bad. We have a lot of pressure from society to have a perfect vagina. It's important that women make sure to go to the doctor if they're concerned about any of these issues.